When I was 20 years old, I got a letter from the gynecologist's office saying that my pap smear was abnormal and I needed to go back in for another appointment. I remember feeling terrified that day as I went into the doctor's office. It felt like everyone in the waiting room was looking at me. When the doctor came in, she explained that she found HPV, but then she was gone before I knew it, before I could ask any questions. I felt so confused and alone and afraid of what to do and what this meant. And I wanted to know more. So I asked a family friend who's a gynecologist if I could observe in his practice. And he said yes. That's when I observed surgeries like cesareans, hysterectomies, and laparoscopies. Standing in the cold, bright operating room, I remember thinking, am I going to be next? You see, I had also experienced severe menstrual cramps and migraines, and I had tried a birth control pill, but I got severe bruising and the doctor told me I had to stop. So I felt alone with the pain and wondering and thinking there had to be something else I could do. One day in the doctor's office, I noticed this sign that said midwives, and I asked him, what's a midwife? And he said, oh, you have to meet the midwives. They're great. Around that time, I also signed up for a nutrition course in college, and I said to a friend of mine, I wonder if there's a kind of medicine that involves nutrition. And she said to me, what about naturopathic medicine? As if I should have known about that. The day after I graduated from college, I got in my car and I drove 300 miles to the naturopathic medical school that she mentioned to me. I walked in and I said, I'm looking for a medical school that teaches nutrition. And the admissions director looked at me with these excited eyes and said, you're in the right place. And that's how I became a midwife and naturopathic doctor. And there I learned that by giving our bodies the right support, our bodies can heal. I did extra training to learn how to help women to reverse abnormal pap smears using nutrition, nutrients, and herbs. Now it's been 20 years. And I've helped thousands of women to reverse their abnormal pap smears. But not only that, I've helped them to get HPV to negative. That's not even something conventional medicine aims for. You see, they follow the pap smear to see if abnormal cells develop. And then if they do a procedure or surgery to remove the abnormal cells. I get phone calls from women around the world every day asking me for help with HPV to prevent it from causing abnormal cells or oral or genital cancer. It strikes me the fear and shame that they feel. It reminds me of what I felt way back when I first found out about having HPV. The thing is that these women are led to believe that HPV is due to high-risk sexual activity, which is completely wrong. The fact is that most all of us have had HPV at some point in our lives. It's not about the virus, it's about the percentages. Only 10% of people with HPV ever develop abnormal cells. So the question is, what is it about that 10% that makes them susceptible? And the answer is stress. What my patients have shown me is that when I help them to recover from stress, they're able to turn their abnormal pap smears back to normal and get HPV to negative. I want you to know that this is possible. I think it's enough of women feeling afraid of HPV, living their lives waiting for this next pap smear, hoping that it doesn't progress to worsening cells. My patients have proven it's possible to reverse abnormal cells and to get HPV to negative. I want that for you too. I don't want you to feel what I felt. I can be your guide.